There's a period of time where I didn't really know if I was gonna ever get better. I didn't know if I was gonna be able to go back to soccer. So those days were definitely really, really hard.
Coming up today, a high school soccer star sidelined for more than a year. The compound condition that took her out of the game and the multidisciplinary care team that helped her fight her way back. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Today we are talking about resilience, patience, and listening to your body, especially for young athletes who are often conditioned to push through their pain. For Kate Ingram, sports aren't just what she does, it's so much of who she is. But just as her soccer career was taking off, unexplained leg pain changed everything.
I just always loved having a ball at my feet, at my hands, doing anything active. My parents could not keep me still whenever I was little, so I always had to be doing something.
Kate Ingram grew up surrounded with competition.
I grew up with 2 older brothers, so that was always kind of a competitive nature with them. I was always kind of competing with them and wanted to do exactly what they did.
As she grew, so did that passion for all sports.
Okay.
Now, a junior in high school, soccer gets all of Kate's focus.
It was fast-paced, and I just kind of fell in love with it.
She's a star goalie for Sporting Blue Valley Club soccer team. But it was about the time she made varsity as a freshman at Blue Valley West High School that Kate noticed something was off.
I felt all of the cramping in my calves and kind of the feeling of shin splints in my lower legs first, but I just didn't really think anything of it. I was training so many days a week that I was like, okay, this has to be normal.
Kate pushed through, but her symptoms got worse. She was referred to the University of Kansas Health System's sports medicine team. Testing showed Kate had 3 things happening in each leg. 1, running caused her leg muscles to expand so much her connective tissue under the skin tightened, causing an aching and sometimes sharp pain, a condition called exertional compartment syndrome, or ECS, common in runners. 2, her back leg pain was a result of her calf pressing against a vein, a rare but serious condition called popliteal artery entrapment syndrome, or PAES. And 3, Kate had pinched nerves in both of her legs. Kate wouldn't just sit out a game or 2, she was out nearly 18 months.
Just kind of watching everybody get to do what they love and just kind of having to sit back and kind of that feeling that you're falling behind a little bit was definitely really hard.
Kate saw orthopedic surgeon Dr. Brian Vopat. She had several procedures, including a fasciotomy and a neurolysis to release nerve pressure in both legs. Later, she was in the care of Dr. Lisa Vopat, director of the Female Athlete Program that focuses exclusively on the unique needs of women in sports.
I think as an athlete, you kind of just solely think of the physical side of it, and so being able to hit it from all different aspects, I think is super, super cool, and it taught me more that it's a whole body thing. It's not just physically, but mentally too.
After months of strict physical therapy, rest, and recovery, Kate is back to the sport she loves and shares this advice for others facing a similar fate.
I know it doesn't seem like it whenever you're in the valley, but put your head down, grind, and you will make it out. There will be a victory on the other side.
As for Kate today, she's keeping her eye on the ball and an almost certain D1 college scholarship with her name on it.
Good job, Kate. We have her mom here with us, Belinda, and we also are joined virtually by Dr. Lisa Vopat. She is the director of the Female Athlete Program at the University of Kansas Health System, and we have Dr. Brian Vopat. He is an orthopedic surgeon with the health system as well. Doctors Vopat, good to see you both.
Good morning.
Hi, how are you?
We're doing great.
Good. Dr. Vopat, Dr. Brian Vopat, can you hear me okay? Oh, I think you're on mute. Okay, we will get you here in just a second. Okay, Dr. Lisa Vopat. There we go. Okay, good to hear from you, Dr. Vopat. Dr. Lisa Vopat, this is great timing because yesterday was the National Girls and Women's Sports Day. Tell us a little bit about the significance of that.
Yeah, this is a day every single year where sort of nationwide we celebrate women and girls in sports at every level, both the athlete level, the coaching level, and just women in industry in sport. And it's just to remind us how far we've come and to continue to strive for equity and the good things that being associated with athletics can bring.
Well, here in just a moment, we're going to talk more about the female athlete program that you run here at the health system. But I want to just find out a little bit about Kate and how you're feeling today.
Yes, I'm feeling great today. I'm pain-free. I'm back to playing, so it's been awesome.
So tell us a little bit about the pain you first started feeling. When was that initial pain arising? Because I would imagine as an athlete hitting it hard, you probably feel a lot of pain a lot of the times.
Yeah, so it was kind of the start of my freshman year, fall season, we play club, and I always kind of noticed this feeling of cramping in my calves, kind of this feeling of shin splints, but it was never something that I really thought was a problem until kind of the spring season came around. My freshman year, we were transitioning, we were doing a lot of club stuff, so we were finishing out our club season, but we were also going into our high school season, and so kind of then I was really kind of hitting it hard, and my pain started to ramp up, and so that's kind of when I knew, okay, something isn't right.
So, Valinda, you're the mom. Are you asking a lot of questions? I mean, you're with your kid in the house. Are you like, hey, what's going on with you? Are you limping around? How are you feeling? When did you notice there was something going on?
Yeah, I think that there were a couple of things that I started to notice. I mean, one, as she said, there was sort of the beginning of that season, and she would come home and she would say that she was having pain down the front of her shins and in the back of her calves, and I think with the combination of that time of year, I thought, oh, perhaps this is just an overuse issue. But I think the other couple of things that came after that was picking her up one day from practice and her getting in the car and immediately removing her socks and her shin guards and saying, why are these so tight? And why are my legs so fatigued? And I just remember that moment, and she looked a little, her coloring looked a little off, and I could tell that she had really exerted herself. And so I thought, that's interesting. And then I think the third thing was when she was starting the second game of her high school season, and she had been seeing the athletic trainer. And I thought that was interesting, and she indicated that she was just feeling a little instability in her ankles. And she said, and I knew that she was seeing him, but she said, you or Dad, one of you has to come meet with the athletic trainer. Coach says he's not going to play me unless you come meet with him. And so it was in that I realized, something's not right.
You're connecting the dots.
Yeah.
Being very observant as a parent.
Yeah.
I want to bring in Dr. Brian Vopat. Dr. Vopat, Kate had multiple conditions that we had mentioned going on kind of all at the same time. How unusual is that? And how does that complicate when you're trying to make a diagnosis?
It occasionally happens. I think it's something you have to keep in mind when you're seeing patients, that it can be more than one thing at a time. It's not common though. When she first came and presented, she saw Dr. Darsh, and she actually had a drop foot where her nerve wasn't firing well on her perineal nerve. And so that's when we first released that. And then she went back to sports. She did well at first, but then she had this pain ongoing. And so that's when we had to dive deeper. So I think it's just all clinicians just have to remember to keep everything in mind when they're seeing these patients.
And earlier we were describing in her story what was going on. Can you maybe kind of in layman's terms explain what she was suffering from and how you treated her?
She had, when she started, she had a weakness of her foot. It's because her nerve was getting pinched right along where it crosses right by her knee. So at first we released that. Then she still was having pain in her legs, coming from two different issues. The first was her compartments, which is this kind of fascia around your muscle were too tight, especially in these female athletes who have really developed legs and muscles. It can cause a lot of weakness and pain after they've been running. And the second thing she had going on at the same time is what's called popliteal entrapment syndrome, and that's where the artery coming behind your knee can get pinched by overdeveloped muscle and cause a decrease of blood supply to her legs when she's running, which causes pain as well. And then sometimes they can, in her case, be in combination. And initially, her screening exams were actually normal, but she kept having pain. So then we sent her to Dr. Gupta, who did an angiogram, a dynamic angiogram, where they saw that the artery was actually getting pinched off when she was being active. So it was exactly what her symptoms were showing, but the initial test didn't show that until we kind of dove deeper into it.
So, Kate, what was your biggest concern when you first got this diagnosis?
Probably just having to be out of sport for so long. It was something that I'd always done, just something that I'd always loved, and so kind of getting that initial like you can't play was definitely disappointing. And all I wanted to do was be on the field and help my team. So initially it was hard, but yeah.
Yeah, that was a full-on, you got to sit this out, girl.
Yeah.
Mom, what was your biggest concern just when you hear this diagnosis of what's the future going to mean?
Yeah, I think is this fixable? Mm-hmm. It was a beyond soccer question.
So Kate, you made varsity as a freshman. This sounds like a really big deal. What was the conditioning like? How much more intense was the conditioning for your body? Because you're much younger.
Yeah, for sure. For high school, honestly, it wasn't too much different from what we'd been doing in club. We hit club season so hard that it wasn't too much, but I think kind of hitting both. In the month of January and February, I'm still in my club season, but we also do preseason conditioning for high school. And so I think it was kind of a mix of, I was doing both at the same time. And so it was kind of a whole kind of holes.
Well, and explain for people who don't understand the difference between, high school, you're playing varsity, that's such a big deal, but you're also doing club at the same time. That's year round. That's very, very intense.
Yes.
Explain that to folks who don't understand.
Yeah, so in club season, for me, we practice 4 days a week. We play games on the weekends. And so, every day we're hitting practice. And then on top of it, I'd be doing conditioning for high school. It was only really about an hour a day. But I'd be doing that 3 days a week. So it was 3 extra hours a week. And I just think all of the exertion just kind of is what ultimately.
It's a lot. It's a lot.
Yeah.
Dr. Lisa Vopat, we had mentioned you are the director of the Female Athlete Program here at the health system. Tell us about the concept of this program.
Yeah, so this was a program that we started back in 2022 because we've recognized that females are different beings than males. They have different biology, physiology, biomechanics, access to training, and therefore, the way that we should look at female athletes is different than we should look at males. Also, a lot of the things that we do in sports medicine has been derived on males and not really studied in females. And so the goal of this program was really to step back and look at the female athlete on an individual basis to see how can we improve outcomes. And then as part of that, we made sure that this was a program that looked at an athlete as a whole. We provide holistic care, addressing nutrition, mental health, in addition to the complaint that brings them in to give them the best outcome once we get them through it.
And of course, you're a former athlete yourself. You get it. You help take care of the Kansas City Current. Why is it so important, though, to have a program that focuses specifically on female athletes? Certainly it was about time that this came around.
Yeah, it's just the science has been lacking. We don't know how to do best by females. And so in order to do right by them, we have to have a program that very specifically looks at the limitations in the science, how we're applying that data. And then we also have to look at females as a whole. Like I said, I can focus just on the leg pain, but we also need to look at other causes of fatigue. We need to make sure that we're optimizing nutrition. It's very common for, female athletes to unintentionally underfuel their body. You got to make sure you're getting enough protein to adequately rehab and physical therapy after you have surgery. And then certainly addressing the mental health component is a big part of it as well, especially in a very prolonged recovery.
Kate, how did you handle we talk about, when you were training and trying to get back physically, how did you handle it emotionally?
Yeah, emotionally, it was obviously really hard emotionally being away from doing what I love, but I just think I was surrounded by so many resources and so many people that were willing to help me. That ultimately is really what got me through. There were so many people that just were there for me and just made sure that I wasn't going through it alone.
Melinda, what was it like watching her step away from the game that she loves?
Yeah, it was awful. Yeah, it is hard. I think as parents, you just want the best for your kids, and when they derive their joy, and that is their social life, that is their team, that's their tribe, and to sort of be sucked out of that. And she was sucked out of that for a year and a half. It was difficult. Yeah, it definitely, it was hard.
That support you have to give her in the home, and kind of be that cheerleader,
her,
knowing that she's going to get back.
Yeah, and you celebrate a lot of the smallest things. You celebrate the smallest victories. It's it's tough. It's tough.
A question, Dr. Lisa Vopat, for you. How does the mental health factor into the recovery process for young female athletes in particular who are sidelined for a long time? In this case, it was 18 months.
Yeah, I think that anytime one athlete has one injury, it's incredibly hard, right? Especially in your sort of adolescent, high school, and even collegiate age groups. A lot of your self identity is wrapped up in being an athlete. It's also your social system, it's how you see your friends. And then to have that suddenly be taken away from you can be incredibly challenging. Kate has been incredibly resilient. Not only did she have one injury where then she got better and then hoped to get back and then was sidelined by another, she had three. And so that prolonged recovery was hard, and therefore we had to really support mental health through all of it to, again, encourage her that there's, a life on the other side of this, make sure that we're prioritizing get back, to get Kate back to what she really wants to do, and then also to find other self-identity that's not inherently tied just directly to sport.
A question for Dr. Brian Vopat. What are the risks when young athletes ignore ongoing leg pain and maybe try to push through it and don't reach out and tell anyone?
I think what you worry about, especially if the pain doesn't go away, like sometimes you have little things that kind of hurt, but it should eventually go away. It shouldn't hurt every time you go and play or be continual afterwards. The biggest one you probably worry about is actually stress fractures. That's what usually occurs when people when we're exercising too much and not getting enough nutrition, and then that can cause to a fracture, which can cause to a prolonged recovery. And then there's some that are even more difficult to fix, like can have a navicular stress fracture that could be very difficult to fix if they don't report the pain. So I would tell all young athletes that if they have continued pain that hurts every time they play, they just need to tell someone, probably have it investigated to make sure that there's nothing worse going on.
What kept you motivated during this time out?
Yeah, I think just knowing that there's a possibility for me to get back to sport and come back. And also I just think I had so many people around me at the time that were telling me, like, we are going to figure this out. I mean, all the resources that I had, everybody was telling me, we are going to figure this out, we're going to get you back. And so I think that kind of kept me motivated, and also just knowing that there was a sport that was waiting for me on the other side. And so being able to come back from that and just kind of know that I have a story with it.
Yeah, what more motivation do you need than that? Knowing that all those folks are waiting for you to return. As a mom, though, when she's cleared to go back to play, what concerns did you have? I mean, you talked about like having kids wrapped in bubble wrap and not wanting them to go out and get hurt again. Were you concerned?
Oh, for sure. Yeah, you are, and you kind of always hold your breath, like, is this really fixed? Is it really, is she going to really be okay? And I think early on, I think some of the things I was just concerned about, are her incisions healed? Is she ability to take the impact of the hits on that? So, yeah, just normal, I think, things.
Mom stuff.
Yeah, normal mom stuff.
Yeah, for sure. Well, we want to show a video from a very special moment. Kate performing the first kick at a Kansas City Current match, helping raise awareness for the female athlete program. Kate, what did that moment mean to you, especially after everything that you've been through? I mean, just being out there on that field.
Yeah, it was for sure. It was just a full circle moment, honestly. It was, at the time, I had just gotten back. I had just been able to play my first game back. And so it was really just this full circle moment of, wow, like, I've overcome everything and I'm on the other side of it and I am healthy enough to be playing.
I called it the field. It's the pitch, right? Did I do that right? Is that right?
Yeah.
Okay, that's the proper term. Okay, gotcha. All right, Dr. Lisa Vopat. Okay, so visibility like this at the professional level there at the Current, so important for young athletes watching at home, I would imagine.
Yeah, I think that to have the professional, NWSL Female Soccer League is such a good example for young girls to look up to, because if you see it, you think you can be it. And, that was something that when I was little, all we had was the women's U.S. national team. I was a soccer player. And now they have an entire league that girls can look at and strive for. Not only that, we have a lot of professional, female athletes, especially in the KC Current, exemplifying what it takes to be a strong athlete and a good role model in terms of overall health and performance in their sport.
Dr. Brian Vopat, for parents and athletes watching today, when is pain a signal to stop and get help and see a doctor?
I think pain that doesn't go away, or it happens every time you play a sport, something that continues. If it happens for a couple days, it's probably okay. But if something is a continual pain, like every day or every time they practice, or it doesn't get better, then I think that's when it should be investigated more.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Kate, what would you tell another athlete who might be sidelined with an injury right now? What advice could you give to someone?
Yeah, I first say definitely just surrounding yourself with a support system. I think it's the most important thing. I think it's really easy to feel alone in your recovery whenever you're going through something like that and being away from sports. So I'd say definitely surrounding yourself with resources, whether that's, friends, family, like systems here at the health system, honestly, really any, just to kind of, have that support system and be surrounded by people who, love and care for you. And also just staying as positive as you can during it. I think it's really easy to look down and say, oh, this is happening to me, or, oh, I, feel bad for yourself a little bit. But I think just staying as positive as you can and just knowing that you're going to get through it.
Valinda, what advice do you have for parents on how to support their kids?
Yeah, I think it's about diligence, and it's about advocacy, and it's about patience. I think the resources are available to us within a healthcare system, but and doctors are somewhat limited within the systems that they work in. But we as parents and as patients have the ability to look for all resources. And I remember utilizing a lot of resources, even just online resources. And some of those resources can be really scary. You can get involved in some groups, and you think, my gosh, do people come out of this? But it also is a way that it educated me, and it allowed me to ask questions and to figure things out. And so I think when you do reach for those resources, and then partnering with all of your medical personnel, I think that is the thing that we can do best for our kids and the people that we love. And just hang in there. It's a long road sometimes, but you'll get there.
Yeah, good advice. Question for Dr. Lisa Bopat: are female athletes more vulnerable to certain injuries, and what type of
Yeah,
injuries
they
might those
are.
be?
Yeah, across the board. I mean, the number one is there's a big discrepancy in the risk for non-contact ACL injury. Females are at 8 to 10 times the risk as males, and it's still something we're really trying to figure out. We're also looking into whether there's differences in other injury patterns throughout the body, but again, our science is so limited, we're just really scratching the surface on how to budge the needle on those injury rates.
A question for Dr. Brian Bopat: how important is early intervention as far as changing the long-term outcome for someone like Kate?
I think it'd be really important, especially different injuries like stress fractures and stuff. You can decrease their return back to play, and you can allow them to go back to the activity sooner. Also, with Kate, it's a great example of her persistence, because sometimes people with the things like this, they'll just quit playing because it hurts, and that's how they'll go on with their life. But she was like, I really want to play. This was important to her. So she kept pushing to find out what's going on to have it fixed. While there's some people who would probably say, hey, I just don't want to play anymore. It's just not worth it. But I think it just really is an attribute to how her strong personality and her perseverance to want to really play soccer.
For sure. Kate, how has this experience changed you overall?
Yeah, I just think it's not only as a player has it just taught me, resilience and how to push through. It's not always a smooth ride, and so it's definitely taught me how to fight through adversity. But also just as a person, I mean, it's just taught me to be grateful for everything that I have. I mean, for 18 months, I wasn't getting to do what I love to do, and so I just think gratitude was a huge thing that it taught me.
Valinda, anything you watch out for now, just to make sure that she's on track, not pushing herself too hard, or is it just you got to let go of the reins?
Yeah, I mean, I think it's obviously it's some of both of that, but it's also reminding her of you see her when she's not rested, or you see when she's inadequately fueled, and it's just reminding her of listen to your body and take care of it.
I want to get to some questions from our viewers this morning. And Jeremy wants to know, this question is for Dr. Lisa Bopat. Are there big differences in common injuries or nutritional requirements for female athletes? And if so, what might they be?
Yeah, we touched a little bit on the injury aspect, but from a nutritional perspective, absolutely. Females are more likely to underfuel their body compared to the amount of energy they're expending in exercise. So getting a total amount of calories to match their exercise endeavors and carbohydrates is key. And in addition to that, females are more likely to have certain micronutrient deficiencies. So there's high rates of low ferritin, which can affect performance and energy levels. Vitamin D is also one that we try to focus on as well.
All right, Tim wants to know if there's any long-term strength and conditioning you do to avoid re-injury.
Not necessarily. With my condition, it wasn't necessarily, oh, something happened and this is how I got hurt. I think I have a lot of people ask me, oh, how'd you get hurt? You know, what happened? And unfortunately, it was just a little bit of the way that my body was built, so there wasn't a lot that I could do to necessarily prevent it or now prevent getting re-injured. But I just think, you know, strengthening my body as a whole, just being as, you know, athletic, mobile, and stable as I can be.
Another question for Dr. Lisa Vopat. Casey wants to know, are there just any advice, any warm-up drills, stretches, anything that every athlete should be doing, male, female, any age, just to maybe avoid injury?
Yeah, so it's called a dynamic warm-up. So this is a warm-up where you're moving your body and you're really doing some short-term stretching to get your muscles ready to go. I think that, you know, there used to be this teaching of doing static holds, 30-minute stretching routine before exercise, but that's actually going to increase your injury rate. That is reserved for after sports activity and needs to be done daily. But before sports activity, a dynamic warm-up is key.
Dr. Vopat, just on that note, what do you want the big takeaway from this conversation to be today?
I think that, I think that resiliency is the key to Kate's story. She went through a lot and she definitely had some hard times. I think also advocating for yourself and from a physician's standpoint, you know, really thinking outside of the box, that sometimes there can be more than one thing going on. And we really have to address all things with the athlete to give them the best possible outcome.
Dr. Brian Vopat, thanks for being with us today. What's the big takeaway from Kate's story?
I agree with her. That's what is how resilient Kate was. And I think she's advocating for what her symptoms are and then just listening to your patients to figure out exactly what's going on. And it can be more than one thing. And you just don't stop at one diagnosis. Like, all right, you don't stop until they get back to what they want to be doing.
Doctors Vopat and Vopat, always great to have you both on together. So thanks for joining us on this Friday. Kate, what's the big takeaway from your story? What do you want people to really get?
Yeah, I just think don't give up. Don't stop fighting. Push through. You know, it's not an easy road, but just continue to push through every day and just, again, surround yourself with people that are willing to help.
Belinda, wrap us up. Yeah. What do you want the big takeaway from this story?
Yeah, I think for me, this was more than soccer. Mm-hmm. This was more about not just returning to a sport, but returning to life. And for her, that was it. There was simple things that we took for granted, you know, walking up an incline on a sidewalk that drew pain, going up and down the stairs, you know, it's those kinds of things. It's wearing a pair of high heels when you're a girl in high school going to a dance that she just couldn't do. And so the ability to get back to those things was, soccer was fantastic, but getting back to life was the key.
The little things.
Yeah.
Yeah.
For us, and I'm so grateful. Well, grateful.
We are grateful too. We're so glad you're doing well. And thanks for sharing your story and being here with us. And thanks to all of our guests. Thanks to our viewers for being here with us. And we will see you back here on Monday. Coming up on Monday, here on the Morning Medical Update, 2 diagnoses, 2 complex conditions, 1 destination. When Lonnie and Don Wade of Wichita, Kansas faced a failing heart and an incurable liver disease, the University of Kansas Health System became the place equipped to handle both.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.